All right, we now welcome Dr. Patrick Luedtke onto the newscast.
He is Lane County Senior Public Health Officer. Thank you so much for being here tonight. Of course, the big news today is Governor Brown's new restrictions. Kids 5 and over have to wear the masks. Bars and restaurants are going to have to close at 10 o'clock at night, and then indoor gatherings are going to be limited to 100 people. So, do they go far enough?
You know, I think they did. We have a signal in the noise that's saying things are not going in the direction we want to, so we obviously had to do something. And of course, that something needs to be based on evidence of what has been working both in our country and in other countries. And I think that it's a measured response. Many of us, myself included, have a little bit of virus fatigue, a little bit of COVID fatigue, but it's not over yet, and we need to do something, and I think these are the right measures.
So what is something that maybe you would like to see the residents of Lane County or maybe even beyond those borders do to slow the spread here?
Well, I have to say, we do know how to slow this virus, and I'm not convinced that we can stop it, but we can certainly slow it, and slowing it is something that's really important. And if everyone were to wear face masks, it would be really, really helpful. And we're especially seeing a fair number of younger age persons, under age 30. I wish I was in that category, but I am not. But roughly half of our cases now are in persons under age 30, and we need to get them to wear masks too so they don't spread it to people who are older and at higher risk.
What do you think about schools reopening in the fall? There seems to be 3 different versions right now of how that could happen.
Yes, you know, this is a complicated issue. I'm feeling for our colleagues in the school system. As I said, I don't believe we can stop this virus, but we can certainly decrease the number of infections. And schools are going to have some cases. We have disease outbreaks in schools every year. Thankfully, they're fairly minor, whether they are viral, respiratory, or they're skin related, or some of the GI outbreaks. We have them. We're well practiced to respond to them, and we've built that bridge to schools from public health. But some schools are going to be more challenged than others, especially those schools with lesser resources. But we're working with all of them. They all have their plans due on August 15th, and public health is going to help them all to succeed. I personally believe that kids need to be learning, and we need to find a way to make it safe, whether it's predominantly online or it's a mix of online and face-to-face. We really need to help schools to achieve what our communities need.
I'm going to kind of go off in a different direction here. Oregon State University, University of Oregon, opening in the fall. What about when all these students come from other states, other parts of the state? Do you have any fears about college campuses, just the gatherings again?
Well, you know, fear is something I don't like to have. I like to have sort of a measured response and an understanding. And when you have a new virus, you don't know everything, so you really have to work hard to understand it well. What I will say is that the Pac-12 has a group that is working really hard to make campus life and athletics safe. I was asked to serve as a public health voice on that group, working with all 12 of those colleges. And it's fascinating, the level of detail, the amount of work that the trainers and coaches and the medical directors are doing to try to make it all safe. And I'll tell you, even down to the level of thoughts of, hey, we're going to have referees out there blowing a whistle, and what happens if they're sick? We don't want them blowing viral particles, so we're going to get rid of those whistles, and we're only going to have electronic whistles that are on their waistband, and they push a button. So there's a lot of work trying to make it as safe as possible, and it's pretty impressive from my point of view.
And Dr. Patrick Luedtke, we certainly appreciate all you and your staff are doing there. Stay healthy, and thank you for your time tonight.
Thank you both for getting the word out.